So I am thrilled to introduce this co-chair chat on sending the Momnibus to the President's desk, featuring Representative Alma Adams. Okay, Congresswoman Adams, it's so good to see you.
It is good to see you too, my sister. It's
Oh
good
my
to see
goodness.
you.
So we've been doing this for a little while now, and it has been truly the joy of my time in Congress to be able to partner with you on our work with the Black Maternal Health Caucus. And so I just want to kick it over to you to hear about your reflections on founding the caucus and the work that we've done together over the last several years.
Well, thank you. Well, let me just say how much of a pleasure and a privilege it's been, Representative, to work with you. A young, remarkable sister who has helped us to keep this show on the road. And I just appreciate you so very much. You know, this has been one of the most exciting things of my tenure here in the Congress. And when you can do things that have real personal meaning to you, that becomes so much more important. So for me, it goes back to my daughter, my only daughter. I call her my baby girl, and she says, "Well, Mom, I'm the only girl," and she is. But she, when we think about this crisis that we have, and it is a crisis in terms of Black maternal health, uh, my daughter almost became a victim, just like other Black women. The physician was not taking her complaint seriously. And so they weren't listening to her and not really trusting that she knew her own body. And I think that's one of the things that we are finding out, that uh, the physicians sometimes think they know more about our bodies than we do. So they dismissed her pain. And it almost cost her life and the life of my granddaughter, who will be 18 years old pretty soon. But yeah, so I almost lost both of them. But over the past 2 years, since we launched the Black Maternal Health Caucus, Representative Underwood, you and I have just talked so much about how terrible these inequities are in our society and in our health system, and just so many of moms have been lost. So when we think about really how important the mothers and the grandmothers, and I'm just a proud grandmother, have 4 grandchildren, 2 granddaughters. So naturally, I am so concerned about Black women in particular. But my daughter is not the only mommy of 2 amazing grandchildren. She was a principal and assistant principal to students at her schools, and now she's doing work with young children and really trying to help kids in public school who are homeless. And so, but if you can imagine that this is such a personal issue for me, it's as personal for a lot of other people. Now, so this is why I kind of got involved as I did. I had an opportunity to introduce a bill as a part of our package, the Momnibus package. And so I'm just excited about all of that work and what it will mean when we get the Momnibus passed.
So let's talk about your bill, the Kira Johnson Act. Tell us what's in it, how we came to work with Charles Johnson and his family, and kind of where we go from here to get this one signed into law.
Well, thank you. Kira Johnson, while I know her through her husband, and now I know her through this act, but this bill was actually named for her, the Kira Johnson Act. That's my bill. She lost her life to this crisis that we've been talking about, the Black maternal health crisis, because she didn't lose it because she wasn't healthy or because she wasn't but she lost her life because she was unheard. And we see that so much as it relates to this whole issue around Black maternal health. In 2016, Kira checked into the hospital with her husband to give birth to her second son, Langston. They had one child already. She was an entrepreneur. She was a world traveler. She was a mother of already one healthy boy, a Black woman, and she did not make it out of that hospital alive after hours of neglect and hemorrhaging, nearly 12 hours after delivering Langston. She passed away. She deserved better than that. She mattered. And we know that this didn't have to happen to her. So, in honor of Kira and for all of the mamas out there who we've lost to this crisis or who we've almost lost, like my daughter, due to errors, due to bias in care, that's why I introduced the Kira Johnson Act in honor of this young woman. So the bill does a number of things. First of all, it makes investments in community-based organizations that are leading this charge to protect moms by supporting doulas and perinatal health workers. It addresses social determinants of health like housing, like transportation and nutrition. It also supports research and bias and racism training programs and the establishment of a respectable maternal care compliance office to address bias and racism. And so when you think about this bill and what it does at its core, it's really about accountability, Representative. It's about empowering our communities, our health partners who, we've been involved with a number of partners who really care about this issue. And it's been about providing safe and culturally sensitive care to Black moms. And these organizations have been doing it for many years, well before we got started on this issue. So I'm excited. The Kira Johnson Act is going to do a lot of good for a lot of good people who certainly deserve it.
You're absolutely right. And we are so grateful for our continued partnership with her husband, Charles Johnson, his leadership in this space. And, that he was willing to allow us to use her name. And even to name this piece of legislation after her. Okay, so we know that the Kira Johnson Act is such an important part of the larger Black maternal health Momnibus bill. And we know that the Momnibus sort of stands out. It stands alone as the comprehensive solution to ending our nation's maternal health crisis. Can you tell us a little bit about why you think it's essential that we move forward with a comprehensive package to save moms' lives?
Well, when you think about it, we're talking about decades now, and this maternal mortality, the rates have actually gotten worse. We hear that it's worse today than 25 years ago. It's gotten worse for all mothers, especially for Black women whose outcomes in terms of health are further compounded by systemic and structural racism. We know that we're seeing that level of disparity in Black maternal health crisis in our community. We say that when white folks catch a cold, Black folks get pneumonia. But Black women in America die in childbirth at 3 times the rate of white women, and American women die in childbirth at a rate much higher than other wealthy nations. And so the Momnibus provides that roadmap for us, as you said, is comprehensive, so that our healthcare systems, our providers, and society will finally make Black maternal and infant health a priority. That's what needs to happen. It needs to be a priority. It's going to fill in the gaps in existing maternal health legislation to comprehensively address every aspect of the Black maternal health crisis. That's what we need to do. We need to look at it and have a comprehensive approach to it.
Yes, ma'am. Okay, so how do we get it done? We know that we need to have bipartisan support to navigate this divided Congress. We know that even if we were to get that bipartisan support here in the House, we have a little bit of a challenge in the Senate. So tell us your thoughts about how we get this bill, the full Momnibus, signed into law.
Well, Representative, let me tell you, first of all, I'm an educator. 40 years I spent in the classroom teaching. But I think with the teaching also comes learning. But to me, it boils down to education. This is not a partisan issue. Health is just not a partisan issue, and the health of our mothers is something that should concern all of us. And so the maternal health crisis affects every district in our nation, not just Democrat districts, not just Republican districts, not just Democrats or Republicans or people who claim no partisan affiliation. 80% of maternal deaths are preventable. 80% are preventable, and as I said, it's increasing. And we don't want to get to 100% because, was it 2 years ago? It was 60%. But our nation is one of only 13 countries in the world where the rate of maternal mortality is worse than it was, as I said, 25 years ago. And so we want to see these numbers reduced. In order to do that, we've got to recognize that we're not going to see this if we don't address the disparities in care that Black women experience. So it's important that we note that the approaches that we use should be those that would reduce racial disparities in the momnibus. And that's one, those are disparities, those would be outcomes that will benefit everybody, not just Black moms, every mom, every family, especially mothers in rural districts. You know, many of our Republican colleagues represent rural districts. So, you know, when we think about this as not a partisan issue, we are all in this together, regardless of where your district is. And so the same social determinants of health that impact Black moms' access to maternal care are faced by rural populations, in terms of the lack of public transportation to get to the doctors, childcare during their visits, perinatal necessities like health and food and infant formula. There's so many factors here. But the Momnibus takes, as we have continued to say, a comprehensive approach. These go beyond politics. It's not a partisan issue. It is a life and death issue. And so we've got to consider it so that it is a life and death issue, and we've got to save lives, all lives in all districts.
Well, I just have to say that you have been very persuasive as you've been talking with our colleagues across the aisle. And we're just so pleased that our bipartisan support is growing, right? And so it shows that our colleagues recognize the universal nature of this crisis, and that, you know, a maternal death touches all of us. And that when we advance these solutions, it helps improve the quality of care for all moms. And I think that, you know, we're going to be able to get this done. But I know that so many of our participants here in the Stakeholder Summit, I know that so many of our partners around the country have been frustrated because they need these resources now. And we know, because the data has told us, and as you've outlined today, that the problem's only getting worse. So do you have a message for any stakeholder who's been with us from the very beginning, or who predates the Black Maternal Health Caucus and who's just been a steady champion in their communities? What would you say to them in this moment?
Well, first of all, be not discouraged. I do share their frustration, and of course, Congress doesn't move quickly on anything, right? And certainly, it's not moving as fast as it needs to do to move on this. And they haven't yet, I think, determined the urgency that this crisis warrants. But we are, as you said, we're seeing some progress. We've got over $1 million, $1.1 billion included in President Biden's Build Back Better Act to address the maternal health crisis. So we don't want to forget that, you know, things are being done right at the administrative level as well. They've committed to using the funds to invest in a more diverse maternal care workforce. We've seen the first bill, you remember this, in the Momnibus, signed into law, the bipartisan Protecting Moms Who Serve Act. And so all of these things should give us some level of encouragement. This bill that was signed into law will strengthen the prenatal and postpartum care for veterans, and would provide the reporting on the racial and ethnic disparities in maternal health outcomes. So the things that we've done, the things that we're continuing to do, those things are working. They're not just working because, you know, they're working because every individual has added their voice to the fight. So I would tell folks, continue to speak up. We need people sharing their stories with their representatives. If enough people talk to their members, they'll begin to listen. They'll begin to take notice. So we really have to educate them. Post on social media, mobilize your communities to better serve Black moms. I've seen more press on this Black maternal health crisis this year than I've seen in a decade, if you think about it, all over TV, radio, etc. So my message to those who are frustrated is simply I want you to know I stand with you. Representative Underwood and I both stand with you in your anger and your grief, but we are not hopeless. And so if we continue to work this thing together as a community, I think we can make the progress that we need to make for our Black moms.
You're absolutely right. So as we conclude this conversation, what gives you hope about the path forward? And do you think that we'll be able to end our nation's maternal health crisis?
Well, let me just tell you that I certainly am positive about this issue. I think, first of all, we've worked long and hard. We've got great stakeholders out here who are working along with us. But on top of some of the successes we've seen, we have to highlight the progress that's being made by our community-led organizations, our health workers, those in the medical field, advocacy groups, because those are the people who've been doing this work. They are the boots on the ground, and they've been doing it long before we introduced that bill in 2020. And so I just cannot express my gratitude for the years and years of advocacy, for passion, commitment, and to making giving birth safer for Black people. So we're going to continue to build on the momentum. I truly believe that we'll get across this finish line and see the omnibus signed into law. And certainly, Congresswoman Underwood, working with you, with your passion and all of the great work that you're doing, we're going to do it. We're going to get this done for Black moms because our mamas just cannot wait.
Well, Congresswoman Adams, we couldn't do any of this without you. This summit wouldn't be happening without you. The Black Maternal Health Caucus wouldn't be an entity without you. And certainly we wouldn't have the Momnibus without you. So thank you for your visionary leadership. I have so appreciated the opportunity to learn from you and to work with you. And I am grateful to be able to call you my partner and my sister. Thank you so much.
Well, thank you. It's just, as I said before, it's been a real pleasure. I have learned so much from you, my sister. Listen, to all of the attendees out there, know that I truly wanted to be with you today. I'm sorry that I was not able to do that. I had work back in the district that I have to do. I'm actually going to be out of town. But listen, I know that you all are going to carry on this great work, and you've got a great leader there with Congresswoman Lauren Underwood, who's going to keep everything moving. But just know that I'll continue to keep you in my thoughts and in my prayers.
Thank you, Congresswoman.
Thank you.